Bonjour tout le monde. Hello everyone. Thank you for joining us. Earlier today, Canada took part in a replenishment conference for Gavi, the Vaccine Alliance, which was hosted by the United Kingdom. Gavi does incredibly important work around the globe, delivering vaccines to some of the world's most vulnerable. They've also been helping developed countries to respond to outbreaks like COVID-19. Gavi saves lives, and Canada is doing its part. Now I want to turn to what is happening later today. This afternoon, we'll be releasing new modelling on COVID-19 in Canada. We'll have more details then, but for now I want to talk about the main takeaways for these projections. The data shows that we are continuing to make progress in the fight against this virus. In many communities, the number of new cases is low, and we can trace where they came from. That's an encouraging sign that the virus is slowing, and in some places, even stopping. But I want to be very clear. We're not out of the woods. The pandemic is still threatening the health and safety of Canadians. Across the country, and especially in areas where we continue to see large numbers of new cases, as well as in places like long-term care facilities and seniors' homes, the situation remains serious. So while we start loosening some restrictions, we also have to strengthen other measures like testing and contact tracing. And as people head back to work, it's even more important that we keep a 2-meter distance from others, wash our hands, and wear a mask where physical distancing is not always possible. This is key to keeping us safe and keeping the situation under control.
Later today, we will be making public the new modelings, and the data clearly show that we're slowing down the spread of the virus throughout the country, but we're not out of the woods. COVID-19 is still a threat for health and safety of Canadians, and the situation is a very serious one, and particularly in the areas where we observed a huge number of new cases and also in the long-term care homes. Therefore, even if we are resuming a number of activities, we should also make more stringent measures in terms of tracing and testing. And it is even more important to wash our hands, to keep distancing socially, and to wear a mask when physical distancing is not always possible. If we don't do so, we might lose all the ground that we have gained, and we should continue to protect our elders or seniors. And even if we are now reopening the economy, our parents, our grandparents should continue to stay home to all the extent possible, because isolation has consequences on our mental health and their financial situation. And
the Canada Pension Plan, Old Age Security, and the Guaranteed Income Supplement were our first line of defence. But over time, this pandemic has made life more expensive. Seniors haven't been able to take public transit. They haven't been able to go to a store or shop the sales because of the virus. Instead, they've had to rely on deliveries to get things they need, and it adds up. And what makes things even harder is the fact that this is the new normal for many of them, at least for a little while. Even as we start to reopen parts of the economy, many seniors will have to stay home for longer to protect their health, and that's really weighing on them. So our government stepped up to help them weather this storm. In April, more than 4 million low-income seniors received a GST credit top-up, worth an average of $375 for people who are single and $510 for couples, automatically in their bank accounts. This was a first step. We also announced that people receiving old age security would get an extra $300 to offset some of the extra costs they've had to cover because of the virus. And to give even more support to low-income seniors, we said that seniors on the Guaranteed Income Supplement would get an additional $200. That means if you are one of the 2.2 million elders receiving both OAS and GIS, you'll get an additional $500 to help you with everyday expenses. And today, I can confirm that you'll be getting that money the week of July 6th. This COVID crisis is tough on seniors, and that's why these additional funds will make a difference, with up to $900 for single seniors and up to $1,500 for couples. Depuis le début de la crise, on a entrepris plusieurs mesures.
Since the beginning of the crisis, we took several initiatives to help seniors. In April, more than 4 million low-income elders received more money directly in their bank account when we increased the credit on sales tax, and for an average of $375 for single elders and $510 for couples. We also announced that we would give an additional $300 additional dollars for old age security holders and $200 for the income supplement. And I can confirm that this money will be disbursed on the week of July the 6th. So in total, single elders might receive up to $900 and couples up to $1,500. At the same time, we are supporting programs and institutions which improve life quality for elders. We're investing in the program New Horizons in order to help them adjust to daily life during the pandemic and stay in touch with their families. We're also providing funds to United Way and to the Red Cross in order to compensate for food insecurity to the most vulnerable seniors. And as we reopen the economy, we cannot forget that we're not all in the same situation. Many people, including our seniors, will have to remain vigilant and apply specific measures to protect their health, and our government will be there to support them. Later today, I will be talking with my counterparts of the provinces and territories for our weekly telephone conversation, and we will be resuming our talks regarding the reopening of the economy within security standards. And thank you again for being with us. Thank you. We'll start with the phone today.
Thank you. Merci. First question, Kate Bolingaro, Bloomberg. Line open.
Good morning, Prime Minister. You've delayed the decision on whether to ban Huawei from Canada's 5G networks. All of our Five Eyes allies have done it. Canadian companies are deciding not to work with them. Are you delaying this because you're afraid of Xi Jinping, yes or no?
Every step of the way, we have listened to our security agencies, our intelligence services, worked with our allies. We will make the right decision for Canadians to both keep Canadians and businesses safe, while at the same time ensuring competitiveness in our telecom industry. À chaque étape, nous sommes en train de suivre les recommandations.
At each step of our decisions, we follow the recommendations of our intelligence services and with our colleagues throughout the world. On this important issue, we will make sure that we protect Canadians and our companies, all the while remaining competitive in our telecom industry.
A lot of time campaigning for a spot for Canada on the UN Security Council. There are some concerns that Canada is too close to the U.S. to get a seat and will simply promote the American agenda. Is it fair to consider Canada an American Trojan horse at the UN, yes or no?
I think we have demonstrated over the past years with our deep commitment to multilateralism, our commitment to progressive trade in this era of globalization. We've become the only G7 country that has a free trade deal with every single other G7 country. We know that engaging around the world is important both for Canadians' health and well-being, but also for the good of our economy. We have done that consistently. Over the past years, I've been stepping up on drawing together questions around financing for development in small island developing states and in Africa. These are things that Canadians have done in the past and will continue to do because we know that it makes a difference. Even as some of our allies, including the United States, seem to withdraw from the world, Canada is engaging in strong and confident ways as Canadians expect us to.
Merci. Opérateur, next question.
Thank you. Merci. Prochaine question, Raymond Filion, TVA. À vous.
Merci. Bonjour, Monsieur le Premier ministre.
Thank you. Good morning, Mr. Prime Minister. You remained silent for a long while on Tuesday during the press conference. This has been talked about by everybody, including internationally. Can you explain that silence? Answer. Everybody is watching what takes place in the United States with a lot of concern, and we too will continue to watch closely the situation and also think about what we could and must do against discrimination, racial discrimination in our country. And this is daily discrimination. So our government is thinking about what we should do, and we should all do our best in this regard, and this is what we'll be doing.
Continue to watch with consternation and horror what's going on in the United States right now, but that can't keep us from looking very carefully at our own systems and the work that we need to do to make sure that the millions of Canadians who face discrimination and intolerance every single day in their lived reality get better support, have Canadians come forward as allies, have a government that continues to work with them to break down barriers and make sure that everyone is treated with respect and given all the opportunities that others have.
En suivi, Raymond?
Many people have interpreted your silence as a non-verbal condemnation of Donald Trump. Is that the case? Answer. Canadians expect me to defend their interests and their values. This is what I've always done relative to the United States and with respect to other countries in the world, and I will continue doing it.
Stand up for their values and their interests. That's what I've done my entire time as Prime Minister, whether it be with the United States or with other countries around the world.
Thank you. Opérateur, prochaine question.
Next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse.
Mélanie Marquis, La Presse.
Merci, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. We are moving towards the deadline of June the 12th. So have you made a decision? What offer have we made to Quebec in order to give them some credibility regarding the help of the Canadian Armed Forces? Answer. I want to reassure our seniors that we will be supporting them, including with the armed forces, and we will find several ways of going through this crisis, and we're continuing our dialogue with the Quebec authorities for the purpose of determining how Canada can best help, and we'll be there to help them.
What are you offering exactly? Fewer soldiers, but for additional months for those soldiers? What exactly are you offering? Our priority is to ensure that seniors in Quebec are well protected, receive the care that is so important and so necessary during the crisis and during the pandemic. Canada will continue helping Quebec to regain control over its long-term care homes and long-term care system. We are currently talking to the province about the best way of achieving this.
We will ensure that elders in Quebec are given the protection and the support that they need. We have been there, we are there, and we will continue to help out. We're in discussions right now with the province of Quebec on how we can best help as we move forward to ensure that all seniors in Quebec are properly cared for.
Merci. Opérateur, dernière question au téléphone.
Thank you. Merci. Last question.
Last question.
Gunn, the Chronicle Herald. Line open.
Hi there, Prime Minister. The Nova Scotia government is saying that they will complete an inquiry, a public inquiry into the shooting that occurred in April, but only if the federal government launches it and takes a lead on it. Is that something that your government is prepared to do?
We have been in very close conversation with the provincial government on this. We recognize that Nova Scotians and indeed all Canadians have significant questions about what happened. The RCMP is continuing its detailed investigation into the events, but there also needs to be a larger review. Canada will work with Nova Scotia on ensuring that it happens in the right way.
As a follow-up?
So you're committing to doing some sort of public or a review with the province on this?
We know people have questions that need answering, and we will work with Nova Scotia to make sure that happens.
Bonjour, Philippe Vincent Foisy de Radio-Canada. Il y a plusieurs personnes qui ont critiqué votre silence.
Radio-Canada. Many people have criticized your silence. Yves-François Blanchet said you lack spine. Jagmeet Singh said you're being hypocritical. Reverend L. Sharpton says it doesn't take more than 20 seconds to condemn what's happening. Why are you unable to condemn what's happening in the United States at a time when the black community needs allies? You call yourself an ally, but all you're giving them is silence. Canada will continue to stand up for minorities and diversity in Canada and around the world. My job as Prime Minister is to defend the values of Canadians and stand up for our principles. At the same time, protect the interests of Canadians as well as their welfare. That's what I will always do. As a government, we are doing a great deal working with the black community. We have a lot more to do, and we will continue.
Values, to express those values, and to ensure that I'm standing up for Canadians' interests as well, and I'm defending those interests. I will continue to do that. In regards to defending racialized Canadians and supporting people all around the world in the fight against racism, I will continue to do that. We have done much hand in hand with the black community over these past years on supporting them, on reducing barriers, but we recognize there is much more to do here in Canada, right across the country. We will continue to do that work.
Vous dites que vous tenez debout, mais vous tenez debout principalement.
You might be standing up for them, but you're standing up in silence. Is that because you fear Trump's government and administration? Do you believe that if you say one wrong word, that'll irritate him and that would lead to repercussions on the border, on free trade? Is that what you're concerned about? That if you say something that he takes badly, as you did during the G7, we will have problems with our neighbour to the south? My job is to defend the interests of Canadians and to make sure that everyone knows what Canadian values are with respect to major issues in the world. That's what I will always do.
Canadians' interests while making it very clear what Canadians' values are. That's exactly what I've done.
Marika Walsh with the Globe and Mail. Video emerged this week of an RCMP officer in Nunavut driving his truck into an Inuk man. That follows a pattern of police brutality in the province, with 3 police-involved shootings and 2 fatalities since February. What is your response to the video in particular, and who should be held accountable for this?
We recognize in Canada that there are systemic discrimination problems, that we need to address our justice system. We need to address challenges in our society that are a lived reality for racialized Canadians, for Indigenous Canadians. Even as we watch with horror what's going on in the United States, we know we have an awful lot of work to do right here in Canada. As a government, we have taken steps towards that, but as you point out, there's much more to do.
And
nous avons reconnu que le Canada fait face à la discrimination.
We recognize that Canada has systemic discrimination in our justice system and in many other institutions, issues that affect Canadians every day, Canadians of diverse origins every day. That is why, as a government, we've taken tangible action in recent years, but we recognize there is still a great deal to do, and we will continue working to become better allies for visible minorities and black Canadians.
You are responding to my questions with a talking point you've used all week, rather than responding to the video. You say you are responding to what's happening in the U.S. with horror and consternation, and you're not expressing those same things for what's happening in your own country.
I have said from the very beginning that Canada is not immune or exempt from the things that we see going on in the United States. Racialized Canadians, Indigenous Canadians have long suffered systemic discrimination in every part of this country. And even though we have taken significant steps over the past years, there is much more to do. And the events of these past weeks in Canada and in the United States have underlined how much more work we have to do, and we will be there to do it hand in hand as allies to the Black community, to Indigenous peoples, and to all racialized Canadians.
Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. Many Black Lives Matter advocates are demanding that governments defund police and instead redirect that money into disadvantaged communities. The mayor of LA, for example, announced that they will be cutting the LAPD's budget by hundreds of millions of dollars. Are you willing to cut the RCMP's budget?
I think there are many different paths towards making a better country, and we need to explore the range of them. We need to look at what's appropriate in Canada, how we can best keep Canadians safe, and how we can best address the systemic racism that exists in far too many parts of our country and far too many of our institutions. We will do that as a government. We will ensure that we are supporting community organizations that need support, supporting anti-Black racism programs, supporting Indigenous peoples, as well as doing the things we need to do to keep all Canadians safe.
Does that mean you're open to it?
We need to look at what is appropriate in Canada, and I think we need to continue to work on ways with the communities affected, with Indigenous peoples, with racialized Canadians, to take the measures that they need. We have put significant funding towards frontline organizations in the Black community. We have funded Indigenous communities significantly. There is more to do, and we will focus on that.
On a separate subject, it is now illegal in Hong Kong to insult the national anthem. It's a move that's widely seen as yet another infringement on freedom of expression. What specifically is Canada doing to push back against this escalation and to ensure that people fleeing prosecution in Hong Kong are welcomed in Canada?
We have worked with some of our closest allies, including the UK, Australia, and others, to condemn the actions taken by China in Hong Kong. We are extremely concerned with their stepping away from the one system, one country, two systems agreement that was signed a few decades ago. We need to ensure that rights are defended all around the world, including in Hong Kong. We will continue to be a country that is open and welcoming to people fleeing persecution and violence. Nous avons travaillé avec nos alliés à travers le monde.
We have worked with our allies around the world to express our profound concerns about what's happening in Hong Kong. While we would like to make sure that the agreement of one country, two systems be respected, we are very concerned about the 300,000 Canadians in Hong Kong who are, of course, welcome to come back at any time. Here in Canada, we are always open to welcoming people fleeing persecution and fear throughout the world.
Your governments are in China for passenger planes arriving from China, arriving here in Canada, as the U.S. has done, and to pick up on what you were saying with regards to Hong Kong and protecting human rights. Will you join parliamentarians in CANZAC countries to demand a special human rights envoy to monitor human rights in Hong Kong?
We are going to continue to make the international flights measures in place protect Canadians. We have taken significant steps to ensure that COVID-19 does not get transported across international borders into Canada. We will continue to keep the appropriate measures in place based on public health recommendations, based on expert assessments of what is needed to do to keep Canadians safe from COVID-19. We continue to work with partners and allies around the world on ways to ensure that China knows that its actions in Hong Kong are deeply troubling, are of real concern for the sake of people in Hong Kong, but elsewhere around the world as well. We will continue to speak up strongly and be there for people who are worried about their futures in Hong Kong. Nous allons continuer de travailler avec nos partenaires.
We will continue working with our international partners and allies to highlight our concerns regarding decisions made by China regarding Hong Kong. As for international flights, we will continue applying expert recommendations on what we need to do to continue protecting Canadians from COVID-19.
Huawei, a top spokesperson at the U.S. State Department said today that if Canada allows Huawei into its 5G network and into its national security systems, the U.S. is going to have to make an assessment as to whether it can continue to share intelligence with Canada. Now, you've been mulling this over for a long time. You've said you're taking all security factors into account. You've said you're talking to security agencies, Canada's security agencies. You've said you're speaking to the allies. So I'd like to ask you specifically, are you prepared to risk losing access to U.S. intelligence if you go ahead and allow Huawei in?
These are considerations that we have been looking very carefully at. Obviously, conversations have been extensive with all our Five Eyes allies, including the United States, as we continue to work with our security services and intelligence agencies. Comme j'ai dit plusieurs fois, nous continuons en conversation avec nos alliés.
We are continuing talks with our allies, including the United States, on that decision. We will continue listening to recommendations from our security agencies and intelligence services to make the right decisions for Canadians. That is the end of the press conference today. Thank you.
Bonjour tout le monde. Merci de vous joindre à
Hello,
nous
everyone.
cet après-midi.
Thank you for being here today.
This afternoon we'll have the pleasure of hearing from Minister Schultz, who is Minister of Seniors, then Dr. Tam, who is Chief Public Health Officer of Canada, Dr. Nu, who is Deputy Public Health Officer of Canada, and we also will have the privilege of having Minister Aidu, Minister of Health, answering questions. Minister Schultz.
Good afternoon, bonjour. The Government of Canada is acting boldly to address seniors' needs during the pandemic. Staying safe at home has created additional challenges and expenses for seniors. Groceries cost more, and deliveries come at a premium. Prescription dispensing fees have increased in many provinces. In April, more than 4 million low to middle income seniors received a supplementary GST credit automatically in their bank accounts from the Government of Canada. Today, we're announcing that the one-time tax-free payment for seniors will be received on the week of July the 6th. This automatic payment will provide $2.5 billion of support for seniors eligible for the old age security, with extra support for those eligible for the guaranteed income supplement and the allowance and this allowance for the survivor. For a low-income senior couple on GIS, the April and July payments will add up to over $1,500 in support to help with increased costs caused by the COVID-19 pandemic. Au total, cela représente
In total, that represents more than $1,500 in support for a low-income couple.
Our objective has been to get this payment to seniors as quickly and simply as possible. We know seniors are more targeted for fraud than others, and they have already been targeted for benefit scams. That's why we're making the one-time payment automatic, to help prevent fraud. Seniors do not need to apply, and they should not share any personal or banking information to receive it. Pour éviter les fraudes, le paiement
In order
est
to
automatique.
avoid fraud, the
This
payment is
financial
automatic.
support complements other federal supports for seniors during the pandemic, which is including $500 million to charities and community groups that help seniors and others get essential services and supplies, such as the delivery of groceries. $2,000 a month for those who lost their job due to COVID-19, regardless of pension benefits. Temporarily extending the GIS and allowance payments for those who are experiencing difficulties submitting their taxes to ensure the most vulnerable seniors continue to receive the benefits they depend upon. We reduced the mandatory withdrawal requirements by 25% for registered retirement income funds to protect seniors' investments during the volatile market, and improving seniors' quality of life and reducing social isolation through the New Horizons for Seniors program. We continue to look at all the ideas that are coming in on how we could better help seniors. During these unprecedented times, we'll always be there for Canadian seniors. Thank you. Merci.
Merci, Deb. I would now turn to Dr. Tam.
Good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 93,441 confirmed cases, including 7,543 deaths, and 51,445, or 55% of cases, have now recovered. Labs across Canada have tested over 1,787,000 people for COVID-19 to date, with about 5% of these testing positive overall. And in the past week, we've been testing an average of close to 29,000 people daily. We thought we'll take this opportunity to go into a little bit more detail on our data.
Bonjour. Comme d'habitude, je commencerai par énoncer les plus récents
As
chiffres
usual,
sur la COVID-19 au Canada.
I will begin by discussing recent data on COVID-19 in Canada.
441 cas
There are
confirmés,
now
dont 7,543 décès et
92,748 confirmed cases, with 7,495 deaths. Laboratories throughout Canada have tested COVID-19 for 1,747,000 individuals, and results for about 7% were positive. Over the past week, we have been testing an average of close to 29,000 people daily. These numbers are changing quickly and are updated regularly on canada.ca/coronavirus.
Slide 2. So as we proceed with relaxation of public health measures to reopen society, data and modelling reinforce that core public health measures are essential for maintaining control of Canada's COVID-19 epidemic.
Diapositive 2. À mesure que nous procédons à l'assouplissement des
Slide
mesures
2.
de santé publique,
As we
pour la
proceed with
reprise de la
relaxation
vie
of
en
public health
société,
measures to
les
reopen
données à la
society,
modélisation appuient l'idée que les
data
mesures de
and
santé
modeling
publique de
reinforce
base
that
sont
core public
essentielles
health
pour garder
measures
la
are
maîtrise de
essential for
l'épidémie
maintaining
de
control
COVID-19 au
of Canada's
Canada.
COVID-19 epidemic.
Slide 3. The epidemiology of COVID-19 in Canada highlights clear regional differences, with the highest number of cases concentrated in our four most populous provinces. Quebec and Ontario account for the vast majority of cases overall, and community transmission hotspots persist in and around the Toronto and Montreal areas. So if you look at the box to the right, we're seeing that the proportion of confirmed cases who have died has increased to 8% on June the 2nd. And based on available information, and that actually reflects, of course, the impact on our seniors. Based on available information, 16% of cases have required hospitalization, and just over 3% have required intensive care. So, of course, as we all know, the lab-confirmed cases are an underestimate of the total number of people infected in Canada.
Diapositive 3. L'épidémiologie de la COVID-19 au
Slide
Canada
3.
souligne les
The
différences
epidemiology of
régionales.
COVID-19
Le
in
plus haut
Canada
nombre de
highlights
cas se
regional
concentre dans
differences,
les quatre
with the highest
provinces
number
les
of
plus
cases
peuplées,
concentrated in our
soit
four most
l'Ontario,
populous
le
provinces:
Québec, l'Alberta, la
Ontario, Quebec,
Colombie-Britannique.
Alberta, and
Le
British
Québec et
Columbia.
l'Ontario comptent
Quebec and Ontario account for 86% of cases overall, and community transmission hotspots persist in and around Toronto and Montreal. If we look at the box to the right, the lower box, regarding the proportion of deaths, the proportion of cases who have died has increased to 8% on June 2nd, reflecting the tragic impact on Canada's seniors in long-term care. Based on available information, 16% of cases have required hospitalization, and just over 3% have required intensive care.
So although people of any age, gender, or health status can develop COVID-19, some people are at higher risk for hospitalization and death, such as older adults and people of all ages with chronic medical or immune-compromising health conditions. Currently, adults aged 60 years and older account for the majority of the hospitalizations, critical care admissions, and deaths. Tragically, over 82% of deaths are linked to long-term care and seniors' homes, where outbreaks have been occurring since the outset.
Diapositive Cat.
Slide 4. Although people of any age, gender, or health status can develop COVID-19, some people are at higher risk for hospitalization and death, such as older adults and people of all ages with chronic medical or immune-compromising health conditions. Currently, adults aged 60 years and older account for the majority of the hospitalizations, critical care admissions, and deaths. Tragically, over 82% of deaths are linked to long-term care and seniors' homes, where outbreaks have been occurring ever since the outset of COVID-19.
Slide 5. All age groups have been affected, although the number of cases among children and youth has remained low. Young and middle-aged adults account for the majority of cases early on and through to the present. These are represented by the blue and the red lines on the graph. The sharp peak of cases in adults aged 80 years and older is largely due to outbreaks in long-term care homes in Quebec and Ontario. This is represented by the green line.
Diapositive 5.
Slide 5. All age groups have been affected, although the number of cases among children and youth has remained low. Young and middle-aged adults account for the majority of cases early on and through to the present, as we can see on the red and blue lines. The sharp peak of cases in adults aged 80 years and older is largely due to outbreaks in long-term care homes in Quebec and Ontario, as we can see on the green line.
Slide 6. Quebec and Ontario cases account for over 90% of the national case count over the past 14 days. No community transmission has occurred to date in Prince Edward Island, the Northwest Territories, or the Yukon. There have been 0 cases reported today in Nunavut. So this slide demonstrates the clear that there are regional epidemics in Canada.
Diapositive 6.
Slide 6. Quebec and Ontario cases account for over 90% of the national case count over the past 14 days. No community transmission has occurred to date in Prince Edward Island, the Northwest Territories, or the Yukon. There have been 0 cases reported to date in Nunavut.
Slide 7. COVID-19 has exploited social and economic vulnerabilities and inequalities across Canadian society, taking hold in settings and among communities who experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with more than 900 separate outbreaks accounting for about 18% of confirmed cases and 82% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include acute care, daycares, correctional facilities, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
Diapositive 7.
Slide 7. COVID-19 has exploited social and economic vulnerabilities and inequalities across Canadian society, taking hold in settings and among communities who experience overcrowded, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with more than 900 separate outbreaks, accounting for about 18% of confirmed cases, and tragically, 82% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include acute care settings, daycares, correctional facilities, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
Slide 8. So one way we monitor whether the epidemic is coming under control is to look at how many other people a single infected person can spread infection to. This is represented by a number called the RT, which stands for the effective reproduction number. Fluctuations in the RT reflect ongoing transmission in areas across the country, especially in and around Toronto and Montreal. Overall, the RT for Canada is currently below 1, but we will need to keep RT consistently below 1 for more than 3 weeks before we can be sure that our public health measures are effectively controlling the epidemic.
Diapositive 8. L'une des façons pour nous de mesurer le degré de maîtrise de l'épidémie.
One way we monitor whether the epidemic is coming under control is to look at how many other people a single infected person can spread the infection to. This is represented by a number, RT, which stands for effective reproduction number. Fluctuations in the RT reflect ongoing transmission in areas around the country, especially in and around Canada's most populous cities, Toronto and Montreal, as well as the communities around these cities. Overall, the RT for Canada is currently below 1, but we will need to keep RT consistently below 1 for more than 3 weeks before we can be sure that our public health measures are effectively controlling the epidemic.
Slide 9. So based on updated case data, this short-term forecasting shows predicted cases and deaths due to COVID-19 out to June 15th. On the left, the predicted number of cases could be in the range of 98,000 to 107,500 by June 15th. On the right, the predicted number of deaths could be in the range of 7,700 to 9,400 by June 15th.
Diapositive 9. Selon les données
canadiennes
réelles actualisées,
based on updated Canadian real data, this short-term forecasting shows predicted cases and deaths due to COVID-19 out to June 15th. On the left, the predicted number of cases could be in the range of 98,000 to 107,500 by June 15th. On the right, the predicted number of deaths could be in the range of 7,700 to 9,400 by June 15th.
Slide 10. So models provide a prediction of what could happen under different scenarios, allowing us to drive our public health action towards a best possible outcome. We continue to use models on an ongoing basis to help us identify which combinations of public health measures applied with what intensity are most likely to reinforce epidemic control.
Diapositive 10. Les modèles fournissent une
prédiction
de ce qui
Modeling is a tool to explore different scenarios,
et ce qui nous permet de mener nos actions de santé
allowing us to drive our public health actions toward a best possible outcome. We continue to use models on an ongoing basis to help us identify which combinations of public health measures, applied with what intensity, are most likely to reinforce epidemic control.
Slide 11. Some of you may have seen this graph before, but it illustrates the potential impact of public health measures on the size and duration of the epidemic under 3 possible scenarios. So we have been aiming for that smaller green curve, which represents the best case scenario, where each infected person only transmits to less than 1 other person on average.
Diapositive 11. Ce graphique illustre les répercussions
Slide
potentielles
11.
des mesures de santé
This graph
publique
illustrates the
sur la
potential
taille et la
impact of
durée
public
de
health
l'épidémie
measures on the
selon
size
trois
and duration of
scénarios
the epidemic
possibles
under
utilisés
3
pour la
possible
planification.
scenarios that were
Nous
used for
visons
planning.
la courbe verte plus petite qui représente le
We are
meilleur
aiming
scénario
for the
où
green,
chaque
smaller
personne
curve,
infectée
which
transmet
represents a
l'infection en
best
moyenne
case
à
scenario
moins
where each
d'une
infected
autre
person only
personne.
transmits to less than one other person on average.
Without a vaccine or treatments, public health measures remain essential to control the epidemic. If we're loosening distancing, this must be accompanied by enhancements to other public health measures, including case detection, contact tracing, and quarantine, to prevent new introductions and to identify and control any new transmission chains. These models all tell us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility.
Diapositive 12. Sans vaccin ni traitement, les mesures de santé
Slide
publique
12.
restent
Without a
essentielles
vaccine or
pour
treatments,
contrôler
public
l'épidémie.
health measures remain
Le
essential to
relâchement
control
de
the epidemic.
l'éloignement physique doit s'accompagner
Loosening
d'un
distancing
renforcement
must be
des autres
accompanied
mesures
by
de santé
enhancements to
publique,
other public health
notamment la
measures,
détection des cas,
including
la
case
recherche des
detection,
contacts et la
contact
mise en
tracing,
quarantaine,
and quarantine
afin de prévenir des
to
nouvelles
prevent new
introductions
introductions
et de repérer
and to
et
identify and
contrôler toute
control
nouvelle
any
chaîne
new
de
transmission
transmission.
chains.
Ces modèles nous indiquent
These models tell us
tous que si nous ne les
that if we
assouplissons
relax
pas
too much
suffisamment ou
or
trop
too
tôt,
soon,
l'épidémie risque fort
the
de
epidemic
rebondir
will most
et de
likely
connaître
rebound
une montée en flèche.
with explosive growth.
Slide 13. This slide compares Canada's COVID-19 trajectory with other countries. And Canada's public health efforts to slow epidemic growth shows that we were able to bend and flatten the curve sooner than a number of countries. Other countries, such as South Korea and Japan, demonstrated strong epidemic control to keep their curves smaller overall. But all countries realize that this is an ongoing effort, requiring sustained public health measures to avoid new outbreaks and or rebound in epidemic activity.
Diapositive 13. Cette diapositive compare les trajectoires
Slide
de
13.
COVID-19 au
This
Canada
slide compares Canada's
avec celles d'autres
COVID-19
pays.
trajectory with other
Les
countries.
efforts déployés par le Canada en matière de santé publique pour ralentir
Canada's
la
public health
croissance de
efforts to
l'épidémie
slow epidemic
montrent que
growth
nous avons pu
show
aplatir la
that we were
courbe
able
plus
to
rapidement
bend
que
and flatten the
plusieurs
curve
autres
sooner
pays.
than a number of
D'autres
countries.
pays, comme la Corée du Sud et le Japon, ont pris des
Other
solides
countries,
mesures
such
de
as South
contrôle de
Korea and
l'épidémie
Japan,
pour
demonstrated
maintenir
strong
leur courbe
epidemic
à un
control
niveau
to keep their
généralement
curves
plus bas,
smaller
mais
overall.
tous les pays se rendent compte qu'il s'agit
But all
d'un effort
countries realize that
continu
this is
qui
an
nécessite
ongoing
des
effort
mesures de santé publique
requiring
soutenues
sustained
pour
public health
éviter de
measures
nouvelles éclosions
to
ou un
avoid new
rebond de
outbreaks
l'activité épidémique.
and or rebound epidemic activity.
Slide 14. Canada has made significant progress to bring the epidemic under control, thanks to the commitment of Canadians who are following public health advice to protect themselves and others. Until there is a vaccine or effective treatment, we must carefully balance the risks associated with spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. Jurisdictions across the country are taking a gradual, phased approach to increasing social and economic activity, with appropriate conditions and controls in place to minimize serious illness, death, and burden on the healthcare system. Priority areas include rapidly identifying and isolating cases, trace and quarantine contacts, continue to increase healthcare and public health capacity, provide a high degree of protection for vulnerable populations and settings, including supporting workplaces, and engage communities to practice core personal public health measures. Thank you.
Diapositive 14.
Slide 14. Canada has made significant progress to bring the epidemic under control, thanks to the commitment of Canadians who are following public health advice to protect themselves and others. Until there is a vaccine or effective treatment, we must carefully balance the risks associated with spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. Jurisdictions across the country are taking a gradual, phased approach to increasing social and economic activity with appropriate conditions and controls in place to minimize serious illness, death, and burden on the healthcare system.
Les domaines prioritaires sont les suivants.
Priority areas include
Repérer et isoler
rapidly
rapidement les cas,
identify and
rechercher et
isolate
mettre en
cases,
quarantaine les contacts.
trace and
Deuxièmement,
quarantine contacts,
continuer à accroître les capacités en
continue
matière
to
de soins de
increase
santé
healthcare
et de santé
and
publique.
public health capacity,
Trois, assurer un niveau
provide
élevé de
a
protection
high degree
des
of
populations
protection for
et des milieux
vulnerable
vulnérables,
populations
y compris les
and
lieux de
settings,
travail.
including
Et
supporting
finalement,
workplaces,
inciter les
and
communautés
finally,
à mettre en
engage
pratique
communities to
les mesures de
practice
santé
core
publique
personal public
personnelles
health
essentielles.
measures.
Merci.
Thank you.
Merci beaucoup, Dr. Tam et Dr. Nu. Donc, de bonnes nouvelles cet
Thank you very
après-midi.
much, Dr.
La
Tam,
première, c'est que
Dr.
la
Nu.
situation
Good
s'améliore
news today.
partout au Canada.
Firstly,
mais
the
il faut
situation is
être,
improving throughout Canada.
être prudent. Il faut que nos
But
efforts
we need to be
continuent pour
cautious.
maintenir les progrès
We need to
que nous avons faits
continue
au
our
cours des
efforts
dernières
in order to
semaines.
maintain the progress
Autre bonne
made over
nouvelle,
the
c'est
past few
l'aide
weeks.
pour les aînés qui
Another
ont
piece of
bâti
good
notre
news is
pays,
the
qui
assistance
sont
to
mes
seniors who
parents,
built
nos
our country,
parents, nos grands-parents.
our
Dans la
parents, our
situation
grandparents.
difficile à la fois d'un point de vue sanitaire et
This is a
économique que ces
difficult
aînés
situation
vivent.
for
Et c'est pour ça
seniors,
qu'en
both the
raison
health and the economic
du prix élevé,
situations.
l'augmentation du prix des aliments, des
Given
médicaments,
high
du
prices and
transport,
the
entre autres
increase
choses, M.
in
Trudeau,
prices
ce matin,
for
a annoncé
drugs
qu'un
and
versement
transit, among
d'aide
others.
additionnel allait être fait
Mr. Trudeau
durant la
announced
semaine
this
du
morning
6
that
juillet,
in the
un
week of the
versement
6th
qui
of
varie
July,
de
there will be
$300
additional
à
assistance
$500
between
par année.
$300 and
Ce
$500
versement
per senior.
s'ajoute au versement du crédit de la TPS qui a
And
été fait
this
le
is
9
added to
avril
the
dernier à
GST credit
60% des aînés,
on the
ce qui
9th
fait
of
en sorte que
April.
pour
That
les
was
aînés qui
for
habitent
60%
seuls,
of seniors,
l'aide totale
which meant
varie
that
de
for
300
seniors
à
living
900
alone,
$,
the
pour
total
les aînés qui
assistance will
habitent
go
en
from
couple,
$300 to
l'aide
$900,
totale
and for
varie de
seniors
600 à
who are
1500
part of a couple,
et les deux
the
montants
assistance
maximum
can go from
900 pour
600
les aînés
to
seuls et
1,500.
1500 pour
So
les aînés en couple.
the
Ce sont
total
des
amount,
montants que
900 for single
environ le
seniors and
tiers des
1,500
aînés
for
vont recevoir.
seniors in a couple.
Quelques ajouts importants. Premièrement,
Those
ces
are some of the
versements
amounts seniors will
sont à la
receive.
fois
I
non
would add,
imposables et uniques.
these
Non
are
imposables,
one-time,
donc, qui
non-taxable
permettent aux
payments.
aînés de savoir qu'ils vont pouvoir garder l'entièreté de cette
Because they're
aide dans
non-taxable,
leur poche
seniors
et unique parce
will
qu'ils
know
n'auront
that
pas
they can
besoin
keep the
d'attendre
that they can keep
pour
all of the
recevoir
payment,
ces
and
paiements.
one time, because
Deuxième
that way
chose,
they won't have to
ces
wait to
paiements sont
receive the amounts.
automatiques, pas besoin de
I would
faire
also
de
add
demande
that
pour le
these
versement,
payments were
ce qui
made
va
automatically.
éviter, ce qui
No
va réduire
application is
certainement
necessary.
les opportunités de fraude
And that
qui
will
pourraient se
reduce
produire
opportunities for
autrement.
fraud, which could have
Troisièmement,
occurred otherwise.
98% des aînés
I would also
vont
add that
recevoir
98%
ces
of
versements
seniors
par dépôt
will
direct,
receive
ce qui
these
va annoncer, ce
deposits
qui va
by
amener
direct
à nouveau un
deposit,
versement rapide,
which will
ce
also
qui va finalement
allow this to occur more
permettre
quickly.
aux aînés de passer plus facilement et plus
This will
rapidement
enable
à travers cette
seniors
crise
to get through
difficile.
this crisis
Alors
more
là-dessus,
easily.
nous serions très heureux de prendre vos questions.
And now we're ready to take
Thank
your
you, Minister.
questions.
So as usual, we're going to start with 3 questions on the phone, 1 question, 1 follow-up before we turn to the room. Operator, over to you.
Thank you. Merci. Our first question, notre première question nous vient de Philippe Vincent Coisy avec Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. J'ai une question qui va être pour
Question.
M. New et M.
I have a question for Mr. New and Mr. Duclos.
Monsieur New, à quel point ce serait important d'avoir des données
Mr.
sur les cas de COVID-19, mais des données
To what extent is it important to have ethnic-specific data on COVID-19 for racialized or indigenous communities? This has been asked for a great deal. Isn't this important?
Merci pour la question. Oui, on
Answer.
sait en
Thank you
effet
for the
que
question.
c'est très important d'avoir
Yes.
les données les plus complètes possibles.
Indeed, it is
Actuellement, on a
important to
déjà
have exhaustive data.
les rapports aussi des situations, des événements, des
Currently,
éclosions.
we have reports on
qui
specific outbreaks
se sont
and
passées
situations
aux endroits, aux
which have
établissements
occurred
avec des
in certain
populations
locations
vulnérables. Par exemple,
and establishments with vulnerable populations.
les établissements pour les personnes sans abri.
For example,
C'est sûr
homeless
que
shelters.
le COVID-19 a vraiment touché, à part des aînés dans
It
les
is clear
établissements
that
de soins
apart
de
from
longue durée,
seniors in long-term
aussi
care
des autres
centers,
populations,
COVID-19 has also
vulnérables.
disproportionately
Et
affected
je veux dire
other
que
vulnerable
c'est vraiment
populations.
une réflexion des inégalités dans notre
And that is a
société.
reflection of our
La
society's
pauvreté,
inequalities.
les accommodations,
Poverty.
les maisons surpeuplées, on peut dire. C'est tous
Overpopulated households.
contribue à une risque augmentée pour
All of that can lead to increased risk for some populations. We are currently in active discussions with our public health counterparts in the provinces and territories. Everyone is on the same page. But there are still issues to be discussed in order to operationalize what we're going to do for all of Canada. Thank you. Minister Duclos, answer. Very quickly, because Dr. New stated most of the answer that I believe is important, I would say that it is important to have disaggregated data on cultural and ethnic effects, and I believe that public health agencies in the provinces are increasingly giving this information. More generally, it is clear that the blood testing that will be generated soon will be able to tell us who tested positive and who has received, or who rather had COVID-19, because there's a difference between those tested and those who actually were infected with the virus. This data will be distributed. We are working closely with the provinces, and we will draw information from this data. Firstly, and this is something we already knew, poor, vulnerable, isolated, fearful populations are too often left to their own devices, and in a public health context, this is not only negative for these populations, but for the entire community. And the other thing that we will draw from this data is how to reduce the spread of this virus in contexts like Dr. New mentioned. For example, in situations where there are housing issues, for seniors, for example, and more generally, where there's a bad housing situation, bad not only morally and socially, but also on a health level. Question, in terms of timelines, when will we have this data, and what is going wrong with the provinces? You say you're in discussion, but if everyone was really on the same page, I feel we would have the data. What's not working? Answer, when it comes to discussions with the provinces, I will let Dr. New answer. Dr. New. I would say that there's perhaps a lack of people on the ground in the last few weeks. With everything that's happened in the provinces and territories with the outbreaks, people are very busy on the ground. And in order to do contact tracing and so on, how to say? Well, it requires a lot of resources.
Va collecter les données. Jusqu'à date,
it's not just about how to collect the data.
Sur les autochtones.
To date, we have data on indigenous communities, but not all provinces and territories gather this data in a regular fashion.
Donc, c'est vraiment une question de discuter des enjeux, parce qu'un autre aspect, je peux vous dire, c'est que
there's still issues to be resolved. Another aspect is even if we wanted to gather socioeconomic data and other data, we also want to avoid stigmatizing and discriminating. We don't want to get into a situation where we're victim blaming people who have been affected or infected. That's another aspect. Additionally, as Minister Duclos said, we also need to ensure that data privacy is protected. We need disaggregated data. And when we're talking about isolated communities,
ne sont pas comme nécessairement on n'est pas nécessairement capable de identifier les personnes.
To fully anonymize the data.
Vraiment technique sur les trains, on est en train de discuter avec nos homologues.
So these are difficult issues, and we are discussing with our counterparts.
Dr. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Ryan Penalty with the National Post. Please go ahead. À vous la parole.
Yeah, good morning, good afternoon, Dr. Tam. I'm wondering, in previous modeling efforts, and we've certainly heard this from other agencies across the country, that data has been an issue. I'm wondering, with this modeling, are you confident that you're getting enough good data from the province to be able to predict where the pandemic is going?
So we've been working hard with province and territory. Some of the models don't use specific case-based data, but use a lot of research on parameters of disease characteristics, like the incubation period or the period of infectivity, that type of thing. So it depends on which model you're looking at. What we now have, approximately 99% of the case-based information now from provinces and territories, which is great, and it gives us the basic demographic information. But we are missing some data points, such as the race and ethnicity data that based on the last question. But we do have now almost all of the case information forms. And there are some fields that are missing still, especially the final outcomes of what happened to people, but those will get filled over time. So I think based on that information, what you've seen in the short-term forecasting projections, that's the one that uses the actual case data. The other types of modeling is based on a wide-ranging amount of information collected through international research, as much as it is domestic, to model those parameters on disease dynamics and transmission. And so those gets updated as well, so that the disease spread models and the dynamic models that you've seen, for the most part, all of them demonstrate that if we relax certain things too soon, if we don't continue these public health measures, there's a very high likelihood of some sort of rebound and resurgence.
Ryan, follow up?
Yeah, I'm also wondering, the data you're showing today shows that crowded places like meat plants and work camps and shelters have all had significant outbreaks. I know just recently there was reports of outbreaks amongst temporary foreign workers in farming operations in Ontario. Do you think more needs to be done in sort of these crowded work settings to ensure that there aren't more outbreaks and thus more community spread?
That is an absolutely vital aspect of controlling the epidemic and going forwards. I think the collective amount of global information, but also in Canada, shows enclosed, crowded spaces, close contacts, lead to what we might call these bigger or larger clusters, or sometimes what we call super spreading events. Those are the kind of settings that's becoming quite evident. So as Canada experienced some of these outbreaks, a lot has been learned. So we've, as the Chief Medical Officer of Health, share the information in the Special Advisory Committee, we've been really focusing on learning what kind of protocols and processes need to be put in place, particularly infection prevention control in certain settings in the workplaces, such as the meat packing plants. But not only that, is that more actual analysis of the social connects beyond just the workplace, but the crowded living conditions, perhaps of the workers, and their linkage then to the wider community is another area that we've learned about. So it's not just the workplace, but the transportation between someone's home and the workplace, but also the homes themselves if they're in crowded conditions. And so in order to address that, it takes a complex set of programs and policies, some of which you've actually heard about. Long-term care, absolutely. That is, knowing everything that we know. Protecting a resurgence means absolutely escalating best practices in all of those settings. We've also been working with Correctional Services Canada and provinces and territories to ensure that the infection control protocols for prevention, but also what to do rapidly if they detect a case in correctional facilities. There's now protocols in place to rapidly test and then manage those outbreaks. So it's in every single one of these settings. And of course, the Minister of Health may want to comment, but we're working quite closely now with other government departments on looking at what more we can do to support temporary foreign workers as well.
Yeah, absolutely. I think, as Dr. Tam said, there's, no secret that the crowded conditions that people live in are driving these outbreaks. And so I've already spoken with my colleague, Minister Qualtrough, about what more we can do to ensure that temporary foreign workers have appropriate accommodations. We've seen outbreaks now in BC and most recently in Ontario. And we know that these workers are critical to our agricultural sector, but we also know that their health is critical to the health of Canadians that live in and amongst them, and as well their own health, which, by the way, they're often far away from their own home. And so we've already tragically lost a temporary foreign worker in this most recent outbreak. And so we will be working together to make sure that temporary foreign workers are protected, and so are the communities in which they are living.
Merci, Madame la Ministre Opérateur. Prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour tout le monde. Mes questions sont pour Dr. New.
Question. I have a question for Dr. New on modeling. Firstly, on deaths and on what you said could occur before the 15th of June between 7,700 and 9,400. We're already close to 7,700 on the 4th of June, so I would like to ask whether we're still in the scenarios in this modeling, or if with the reopening that we've seen recently, I'm wondering if that number is going up faster than expected. Answer. Thank you for the question. It's always hard with modeling. It's not a crystal ball. We do our best with the data based on what's currently occurring, for example, in long-term care centers. Because that is the place that is currently the site of the most deaths in Canada. Now, with what's occurring in Ontario and Quebec, with the Canadian Armed Forces, that has helped. They are there to help the public health authorities in both provinces. Currently, with the deaths we have now, that reflects what's occurred. That reflects what we did 2 or 3 weeks ago. And as for the measures we're taking now, we'll see the results of that later. We hope we'll see lower infections and deaths, but only in 2 to 4 weeks. So with our range of models, we're estimating between 7,700 and 9,400 deaths by June 15th. And currently, we're still looking to be between those extremes.
Oui, et ma question suivie, c'est sur la...
Follow-up question. On page 12 of your presentation, you have 2 graphs. One graph that shows the current curve, which is going down, and then in the other graph, we see a sudden spike in cases in October in the fall. I would like to ask what could potentially lead to that increase in cases in the fall. Do you think we're moving towards such a scenario? Answer. Thank you for the question. I'm not trying to scare Canadians, but it's really what we all do as Canadians throughout the country. So far, we've all worked hard and we've flattened the curve, but now the challenge is that with summer and the good weather, everyone is going to be leaving their homes, and it can be difficult to always remember to practice good public health measures. We've mentioned many times these important measures. We need to continue to respect physical distancing, good habits like frequently washing your hands, and if you're in a situation where you can't physically distance, then you could consider using a non-medical mask or a face covering if, for example, you're on public transit or at the grocery store. We're hoping to avoid a scenario like that. But if people find this too difficult, and of course with the loosening of measures in each province and territory, we always need to remember public health principles, even if each of these measures is loosened. Of course, we also need to help the economy recover. We need to allow businesses to open, but we need to strike a balance. We want to avoid a scenario where there's another spike. Thank you.
About just slide 12 and the differences between the two
slide 12, yes. Looking at slide 12 in terms of what happens between now and the fall, at the end of the day, it all depends on what Canadians do across the country because, with the nice weather, with the summer coming, people going out, it's sometimes more difficult to remember that you have to remember, to keep practicing all those important public health measures, keeping a physical distancing where appropriate or where you can of 2 meters. If it's not possible, wearing a face covering or non-medical mask, also frequently washing your hands, all those things that we've repeated many times. And if we do that as a country, then I think we're in a good shape and not going to have this, resurgence of cases in the fall. But if we don't as a country, then that's what might happen. And of course, the challenge is, of course, as well, is that as we try to, like you say, restart the economy, as businesses start to open up, as provinces and territories start to, as they say, relax certain measures, we all need to keep a careful eye in terms of what happens over the coming weeks and months. So hopefully we don't get into this situation in the fall.
Merci, docteur. On va maintenant passer aux questions dans la salle. Mackenzie.
Mackenzie Gray from CTV. Dr. Tam, my first question's for you, and I'll have a question for Ms. Rideau as well on this. You mentioned in your presentation that largely the cases right now that are coming up are in Toronto, GTA, and Montreal. If that's the case, is it fair to say that we've essentially flattened the curve outside of those 2 hotspot areas? And in that same vein, Ms. Rideau, in Ottawa, the Mayor Jim Watson's saying, look, we're under the same provincial restrictions as Toronto is, despite the fact that we're nowhere near as bad in terms of the number of cases as Toronto is right now. So should provinces, in particular Ontario and Quebec, have regional reopenings to let cities such as Ottawa, as an example, get back to business because the situation isn't as bad here?
So in the data that we've shown, and for example, the effective reproduction number, that's the composite for Canada, but we know that it's actually quite different across the country, and those epidemic curves are extremely different between PEI, BC, and Ontario. But I think it is important to sort of drill down in terms of looking at particularly these very big provinces with very different sets of circumstances in the local public health unit. So we've structured guidance and are looking at safe reopening. But I do think that it depends on local data and as to how they want to manage that. And as you can imagine, the density of Toronto, the population, and what activities are undertaken there is quite different from other areas of the province. So I think local public health and working together with provinces will take that into account. I mean, one example is I think as Quebec is carefully opening up certain aspects of society, including schools, they've taken into account the Montreal situation and sort of slowing some of those approaches while looking at outside of Montreal and see what they can do to, have a more balanced approach, if you like, in managing this epidemic.
I think Dr. Tam's covered the sort of science behind it very well. And I would just say one other thing, coming from a small area, Thunder Bay, Ontario, with lots of small communities, it doesn't take very long for an outbreak to really gain some steam. If we look at, for example, outbreaks in mining camps in my region, which then drove a small cluster of infections in an Indigenous community nearby. And so I think those are the kinds of considerations that have to be made at the local public health unit, balancing the capacity to manage any particular local outbreak and understanding really well what's driving transmission in that, or what has the potential to drive transmission in that region. Because for some of those smaller hospitals and the many communities I represent, a surge could be very difficult to manage in that sense. And so I have weekly calls with my own public health officer and the head of the Thunder Bay Regional Health Sciences Center, so that I understand what's happening from a district level. And I think that's been very helpful for me to understand both the importance of having some regional control, but also the fragility of some of the areas depending on what their health resources are.
Dr. Tam, one of the things that was not in this presentation of the modeling that you gave that has been in the previous ones was the long-term death and infection rate that you have put forward before. From what I was able to kind of understand, and correct me if I'm wrong, we're in the green zone that we spoke about before of the chart where we had the only small bump, where we seem to have flattened the curve, broadly speaking. If we look back at the previous things you've done, that put our death rate over the total pandemic between 11,000 and 44,000. So two questions for you on this. Why did we not have the long-term death and hospitalization rate and those things that we had in the previous things? And is it fair to say that the numbers are similar to what we were looking at before, and the 44,000 range is the high end?
Yeah, so again, those were scenarios for planning purposes, planning for the worst case, or we were essentially striving for the best case. So what some of the estimates, and it's just a matter of the length of this presentation, and things for scenarios don't change very much for planning purposes. What we have, I think, going forward, for example, some of the serologic tests that we need to do to actually estimate how many people have been infected. So that we know the lab confirmed cases is probably just the tip of the iceberg. So the serologic surveys will give us a broader look. The other thing is that there's a very big difference between what we call the case fatality ratio or rate based on the confirmed cases, which is 8%. But when you don't know what the underlying population denominator actually is, then you can't actually calculate the mortality rate, if you like. So the numbers that we provided before was that kind of number, as opposed to the case fatality rate that we looked at. So there's a number of missing data elements which we'll have to look at to calculate in the end. And usually it's by the end of the epidemic you can actually figure out the actual case fatality. So some of that work still has to be done. But if the serologic surveys show that the population exposure hasn't been very high, it'll probably confirm the fact that we were in that sort of green curve.
Bruce? Hi, good afternoon. A question to Dr. Tam. Slide 6 talked about the impact on vulnerable populations. I'm just wondering, what is the impact of COVID-19 on racialized Canadians? And do you have a good handle on that?
So I think this is important to outline that some of these outbreaks do tell us something about racialized populations experiencing health inequities. So even without some of the information on every case, the outbreaks themselves, when we looked at them, points to the fact that a lot of the workers who support long-term care, who work at some of the workplaces, like the meat packing plants, are in those populations who are in the lower socioeconomic spectrum. They have more crowded housing, and they are in some of the racialized populations. So from these outbreaks, already we can tell that there's a disproportionate impact, and hence some of the policies that needs to be in place to support them. For long-term care, for example, we know that personal support workers have been severely impacted, and some of them have passed away as a result. There's a few deaths amongst the health workers, and it's evident that it's this group that is being more severely impacted. So some of the work conditions is a complex mix of health inequities, as well as the actual crowdedness of the work setting or the housing. We also do have the Canadian Institute for Health Research supporting some research in this area, so we need to also look at the data coming out of those research studies. So it's not just case reporting, but actual more in-depth research that are being funded at the moment. And I do know of one, for example, studying specific impacts on First Nations, Indigenous, and Métis populations in both urban as well as on reserve settings. So those kind of studies will yield a bit more information to help us direct our policies and our programs. But I think temporary foreign workers, again, as we just mentioned, is a population that we need to support. So all the people, while I think some of us who can stay at home are staying at home, there are many, particularly in the population most impacted by health inequities, are out there doing the essential work.
It's Dr. Tam or Minister Rideau. Do you know what the reproduction number is for Ontario? And given the concentration of cases still in Ontario, notably in the GTA, can they safely contemplate reopening? And are you worried that, given the high numbers and what the impact might be perhaps on the upper end of some of your model numbers here?
So I think the models show it doesn't really matter where you are if you are not really careful about restarting some of the social and work contexts. You might expect to get a resurgence. So that's just broadly speaking. And so it is very much the local public health unit that is able to sort of look at the specifics on the ground. The overall Canadian reproduction number is primarily driven, as you can imagine, just because of the population size by Ontario, as well as Quebec, but Ontario drives that. And you've seen the fluctuation sort of around that one number. And so we know that that reflects some of the fluctuations over time in Ontario. So you're sitting very close to that number one, and which means it doesn't take much potentially for resurgences to then take off. But that's to be balanced by some of the other public health measures, and that's the lesson from some of the modeling, is that then you've got to have the testing capacity to rapidly detect the cases so that the contacts can be rapidly ascertained and managed. So that's how you're going to have to counterbalance the sort of reopening with the ability to immediately detect and control those outbreaks.
Thank you, Doctor. We'll now go back to the phone. Operator.
Thank you. Merci. Our next question, notre prochaine question, je suis comme Hélène Duvetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour le Dr. Nu. J'aimerais juste
My question is for Dr. Nu. I'd like to come back to my question, to the question of my colleague from CTV. In mid-April, you provided projections on the number of deaths in autumn, depending whether there was a 1, 2.55, or 10% contagion rate. I would like to know which of those curves we're on now and how many deaths that would lead to in the fall. Answer. Thank you for the question. As Dr. Tam and I mentioned, it's difficult. If we want to know the total number of deaths, we really need to wait until the end of the pandemic in Canada.
avec les modélisations, c'est
Our models
seulement
and predictions
avec les données on a actuellement.
can only
Et
be based on the
comment
data we
dire,
have
c'est
now.
pas une boule de cristal.
It's not a
Donc,
crystal
je
ball.
pense pour l'instant,
And
le
so,
Canada,
for the moment,
on a bien fait, on a aplati
Canada
la
has
courbe.
been doing well. We've flattened the
Maintenant,
curve.
si on peut dire, on est toujours comme on dit, dans la zone verte, mais
We're still
il faut
in
pas
what I
comme
would
dire,
call
lâcher,
the green
il faut
zone, but
assouplir avec
we
toutes nos
shouldn't
mesures de santé publique parce que si tout
stop
le monde
with our
pense que
public
OK,
health
c'est
measures
fini,
too
c'est
soon, because
terminé,
if
on a
everyone
bien
thinks
fait,
that things are over
on peut retourner comme c'est au
and
normal.
then we can go back to
C'est sûr, on
normal,
va avoir une autre pic.
then there will
Donc,
definitely be another
je
spike in
pense que
cases.
c'est vraiment important. Je pense qu'on a aussi appris des leçons avec
And I
tout
think
ce qui
we've
se passait
also
dans
been able to
par
learn some
exemple, les
lessons.
établissements de soins de longue
For example,
durée.
what's happened in
Je
long-term
pense qu'on
care.
est en général mieux préparé. On a déjà, comme dit,
I think we're better
amélioré
prepared.
les protocoles pour
We've improved
pour la
protocols
prévention, contrôle des infections
for
des
the prevention
établissements de
of
soins de longue
infection
durée.
in long-term care.
Et sûrement, on attend avec tout ce qu'on fait maintenant, actuellement, ça va porter des
And with
fruits en
everything we're
automne.
doing now,
On espère
we
de
hope
pas avoir
that
des
that will
autres
lead
éclosions dans les
to better
établissements de
results in the
soins de
fall and that there won't be more
longue durée,
outbreaks in long-term
comme on a eu
care
déjà jusqu'à date. Donc,
like we've
je pense
seen
que
so
pour,
far.
la réponse, si je suis optimiste, je peux vous dire
So for
que
the answer,
oui,
I can say that I'm
on
optimistic.
attend peut-être pas un si grand nombre de décès parce
I
que
can say that we
avec
expect
tous
a
les
lower
leçons
number of
appris,
deaths because with all the
espère
lessons
de
learned,
mieux faire, pas seulement pour les
we
établissements
hope
de
to
soins
do
de
better
durée, mais
not
aussi
only
comme Dr.
for
Tam
long-term
l'a dit,
care, but
dans
as Dr. Tam
les
said,
autres, comme dit,
in all
contextes et
other
les autres
contexts,
situations, comme aussi avec les travailleurs étrangers, temporaires
for example,
d'étrangers,
when it comes
aussi
to
pour
temporary
protéger
foreign workers
des populations
and
comme
to
ça.
protect
Donc, je
populations
pense
like
que
that.
si avec tout le Canada, on continue avec nos efforts,
I think that we're
on
continuing
peut
with our
peut-être
efforts.
entendre, pas
And
une
if
pic,
we
en
continue
automne.
with them, we can
Merci.
hope to avoid another spike in the fall.
Oui. Oui, mais avec respect,
Follow-up
Dr. New, vous
question.
n'avez pas répondu à ma question.
With
Je vous
all
ai
due
demandé,
respect,
on
you didn't
s'enligne
answer
vers
my
quelle
question.
projection à cet automne? Vous me dites qu'il faut
You
attendre à la
said,
fin de la
what kind
pandémie
of
pour le
forecast
savoir. Mais à
can
la
we expect
mi-avril,
to
vous
be
nous
going towards
aviez
this fall?
offert des
You said we need to
projections
wait till the end of the
pour
pandemic,
l'automne.
but
On n'était pas à la fin de la
in the middle of
pandémie. Alors, je
April,
comprends pas
you did give
pourquoi
us
aujourd'hui,
forecasts for the fall.
vous ne
We
vous
weren't at the end of the
risquez pas
pandemic then,
à
so I don't
projeter
understand why
votre
today
courbe
you're
jusqu'à
not willing
l'automne.
to look forward in your modeling until the fall.
C'est difficile parce que si
Answer.
on parle
Okay, it's
vraiment
difficult
de la pandémie,
because if
on
we
a
speak
déjà
of the pandemic,
dit que c'est vraiment un virus, un nouveau virus que
this is of
personne
course
n'a
a new
l'immunité.
virus.
Donc,
No one has immunity.
ça va prendre même des années pour avoir peut-être comme
It will
une
take
immunité
years
collective.
to have herd
Donc, je pense
immunity.
qu'il faut commencer à se concentrer avec nos affaires pour vraiment comme dire, continuer
So I
à
think that we need to
contrôler
continue to
la
control
propagation
the
du virus.
spread
Donc, c'est
of the
difficile.
virus.
Pour vous dire
It's
maintenant
difficult
qu'on
to
est
say
sur
now
le modèle pour avoir seulement comme 1%, 2%, 5%
that we have a model where we can say, okay, 1, 2, or 5% of the population.
L'enjeu le plus important, c'est
Because
toujours contrôler
the
la
most
propagation
important
du
issue
virus
is
pour
to
pas
control the
déborder des
spread of the
systèmes
virus
de
in order
soins
to
de
not
santé.
overly burden
Ça, c'est notre
the
but.
health system.
Et c'est difficile pour moi maintenant de dire, OK,
That's our goal.
on estime on peut avoir un taux d'infection.
It's very difficult for me to estimate right now.
Prévalence d'infection dans toute la population.
It's very hard to estimate the prevalence rate in the entire population, that it's going to be 1 or 2%.
Ce qu'on a déjà aussi dit, M. le ministre Duclos a aussi dit qu'on est en train de lancer
Minister
toutes sortes
Duclos also
d'études
mentioned that
comment
we've
dire, pour
started doing all sorts of studies
séroprévalence, parce qu'il y a beaucoup de monde au Canada peut-être qui ont eu
with
une
serological
infection,
tests.
qui ont été
A lot of people
contaminés
have
et qui ne savaient pas qu'ils
had
avaient
the
l'infection.
infection,
Donc avec des études,
but they may
avec
not know that they had
d'autres
it.
recherches, on peut
So with these
être
studies
dans
and research,
des semaines et mois à suivre,
in
on
the
va avoir
weeks and
une
months to
meilleure
come,
idée. C'est
we're going to have
vraiment
a
c'est
better
quoi
idea
le vrai,
of the
au
true,
moins on va
of
avoir
the
une meilleure idée,
true
c'est quoi la prévalence
prevalence of the
d'infection
virus
dans
among
toute
the
la
population.
population. Mais c'est difficile pour moi aujourd'hui de dire
But today,
exactement
it's difficult for me to
qu'est-ce qu'on
give you
peut
an exact answer to
prévoir
that
pour
question
l'automne.
regarding the fall.
So maybe just in English, I'll just point to the fact that today we've just, there's an actual publication, the Canadian Communicable Disease Report, And in it, there is a publication on the modeling methodologies of the public health agencies been using with other colleagues across Canada in the academic sector. And I believe, if I recall correctly, a table similar to what you've seen before, it's actually published in that publication. So we'll make sure people get the link.
Thank you, doctors. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Stephanie Levitt with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon, and thank you for your patience with taking all of our questions. That last slide seems to suggest that under any scenario, the number of cases will diminish to nothing by next spring. Is that really where your head is at? I mean, do we need a vaccine for that, herd immunity?
No, that's so what we're trying to show, I think, is the modeling study. So what modelers try to do is just input a lot of different variables and scenarios to see what might happen if you change the various public health measures. So what they're trying to demonstrate is, well, what happens when we increase contact rates in the population? And with or without the rapidity at case detection and quarantine, for example. So they input multiple different scenarios into that to demonstrate a resurgence. And I think that, resurgence can actually occur at any time over the course of the outbreak as well, depending on what we're doing on the ground. So we mustn't forget that. This is just a modeling dynamic model to demonstrate, and they can vary these variables, input tons and tons of sort of scenarios to show what might happen in terms of a resurgence. So, the graph isn't finished, but they can actually input any number of scenarios. And as we see what happens in Canada with the kind of measures that we're doing, they can actually input different things to see what the outcomes might be. But I think based on all the different modeling that are published, the majority of models will show you that physical distancing and reducing mass gathering, all of those things have actually managed to let us control this epidemic. Any easing of them without a counterbalance of rapid case detection and contact tracing, quarantine and isolation can lead to a rebound. So I think that is the key message.
Okay, and thank you. And my follow-up is actually to Minister Schultz about the top-up today. There's 2 OAS benefit payments that are going to pass before this top-up comes into effect. So why is it taking so long?
Thank you very much for the question. I really appreciate having the opportunity to share this with Canadians. We are committed to getting the payment out as quickly as possible, but also as simply and easily as possible for seniors. So we didn't want seniors to have to apply. We wanted it to be automatic. And so this required us to create a new effective delivery system that will assure that the accuracy of the data so that all 6.7 million seniors will be able to get the benefits that they qualify for. So that's the reason why it's taken a little bit longer. We want to assure accuracy, and we want to make sure seniors are not vulnerable or not exposed to any fraud or the kind of things that we've been seeing as people are applying. We wanted to make sure that it was simple and it's easy, and that seniors get it. All 6.7 seniors, million seniors, will get this benefit rather than having to apply. Thank you.
Thank you, Minister. Operator, last question, please.
Thank you. Merci. Our last question, notre dernière question, nous vient de Mélanie Marquet avec la presse. Please go ahead. À vous la parole.
Bonjour, merci. My question is for Dr. Tam. Modelizations, you had long-term projections. You had information about what would happen within the population with a 2%, 5%, 10% infection rate. And we don't have this data anymore. Why are you now hiding what you were actually giving out as information in today's report?
Yes, so those were planning assumptions, and the different, so the red, green, and blue, I think, curves. We can certainly provide that table again, but those would not have shifted. They are planning scenarios. But what I have pointed people to, and maybe we can get our media relations to send out the link, is that today's publication of the Canadian Communicable Disease Report will show a similar kind of table in terms of the different attack rates. Remember, we don't actually know the attack rates for Canada. The attack rates for Canada, because we don't know the number of people actually infected in Canada. So what we're showing today is based, the epidemiologic data is based on the lab-confirmed cases, and serologic and other studies will eventually tell us the percentage of the population of Canada that is actually infected, or at least give us some estimates of that. But you will find a table of this in that publication, and we will make sure people have that.
Mélanie, en suivi?
Okay, please do. And my next question is about, well, Dr. Tam ou Dr. Arnoux, it's, on slide, so that's slide 3, I'm sorry, about the number of cases. Well, the difference between women and men, it seems like as though men are really much more likely to be infected. It's women, it's 57% against 43. Do you have some idea why that is, or some kind of thesis about this theory?
So this is Teresa Tam. So there are certainly hypotheses, but I think further data needs to be analyzed. But some of it might actually reflect some of the the workers that have been affected as well. Those who work in long-term care, it may reflect the age of the populations affected as well. So there's a number of theories on that.
Thank you, Doctor. Ceci met fin à la conférence de presse. That's it for today. Thank you, everyone.